All right, I think maybe many new people. All right, welcome to Fostering Post-Traumatic Growth and Resilience webinar. Just as a few reminders, the chat session, you can use the chat. And if you have questions, go ahead and put them in the Q&A, and we have time at the end. I'll look at the questions at the end after the presentation. My name is Kathleen Anderson, and I have a daughter who had a heart transplant. It was about almost 7 years ago, and she was almost 2. And I have with me today Dr. Gillian Mayersohn. She is a pediatric psychologist at St. Louis Children's Hospital and professor of pediatrics at Washington University School of Medicine. She's also a psychologist for solid organ transplant, dialysis, the Heart Center at St. Louis Children's Hospital. And some of her research interests include pre-transplant psychological evaluations, adjustment to coping with chronic illness, and many other things. And we're very excited to have her here. So let's welcome Dr. Mayersohn. Thank you.
Thank you so much for having me. Let me pull up my screen. So first and foremost, I have no disclosures to report. So we've got a couple of objectives for today, and I do want to make sure we leave time for questions. So I'm going to define and describe resilience, coping, and post-traumatic growth, which I'm going to call PTG from here on out. Summarize a little bit of the research on PTG in the pediatric and adult solid organ transplant, and you'll understand why I'm talking about adults when we get to that point. And then discuss some strategies for facilitating positive coping, resilience, and growth. So many of you probably know this and experience this, but often the diagnosis of a chronic illness is experienced as a loss from a functional standpoint, from a behavioral standpoint, from a role standpoint. And these feelings are similar to those that occur during the processing of bereavement, and it's loss for the child and the family. Sometimes, if it's a prenatal diagnosis of a chronic illness, it can be that parent's anticipated life for their child. And depending on the age at which a child's diagnosed, when they have their transplant, right, that's how much their role or their life changes. So there can be a lot of strong negative emotions and a lot of environmental invalidation. I see this a lot in the transplant world, particularly in the post-transplant time, where people who don't understand transplant and still see it as a cure, which we're not there yet, hoping eventually, we'll say, well, at least you got a heart, or at least you got a liver. And we all know that there are many challenges that come in the post-transplant time period. So some oversimplification of that problem. And this loss framework, as humans, really increases our compassion, but it also decreases our judgment. So there is this push to shift to the focus on coping and resilience building. So what are some of the signs of positive adjustment? So being open to recognizing challenges, functioning as well as possible, or as I like to say, in spite of something, not because of something. Some anticipation and preparing for the future. A willingness to ask for help and resources, and then some age-appropriate and normative behavior. So I think it's important to just acknowledge that there are multiple terms out there in the psychological literature, in the medical literature, and just in the community about positive changes. And so some people refer to this as benefit finding. Some people call it positive psychological changes. Some people call it stress-related growth. Some people call it thriving. And some people call it resilience. I'm going to talk a little bit about the difference between resilience and PTG. So what is post-traumatic growth? It is the positive psychological change experienced as a result of the struggle with highly challenging life circumstances. So we believe that the recovery from trauma is a meaning-making process that depends on cognitive rumination. And it's not simply a return to baseline. It's an experience of improvement that for some people is deeply profound. So it's shifting one's sense of self from being a victim to a survivor, as survivors often see themselves as strong and capable. It's viewing oneself as being able to endure any of life's challenges. And it's seeing life as more fragile and having a greater awareness of one's mortality. It occurs within these 5 domains: new possibilities, relationships with others, appreciation of life, spirituality, and personal strength. And it doesn't ignore the suffering that's caused by traumatic events. So for growth to occur, it's believed that there has to be a threshold of distress. So it's a inverse, sort of upside down U between post-traumatic growth and post-traumatic stress. So if someone has so much post-traumatic stress that maybe they meet criteria for PTSD, they're not going to be able to see any of those positive changes. And so there's a sweet spot at the top between the two. In terms of talking about the difference between PTG and resilience, they do share some conceptual ideas that tap into the same domain of, manifesting a positive experience after adversity. But resilience really differs to a dynamic developmental process that's adaptation, whereas PTG is transformative. And it doesn't mean that PTG is just positive adjustment. It's that there are different paths or changes in those 5 domains that I just mentioned as part of that process. So resilience focuses on adapting and adjusting to adversity with or without struggling, whereas PTG focuses on that transformative change resulting from a psychological struggle that is often caused by a shattered belief or worldview. So just a little bit more about PTG. So for it to occur, we have to have what's called cognitive rumination. And usually when people hear the word ruminate, they think about a negative association, but simply it just means having a repetitive thought or pondering information. And this can be really deliberate and productive as compared to just intrusive. And this plays a role in someone having PTG. So a lot of times we'll hear these sort of why me questions, and a patient exploring that with me as a psychologist, with their family, with their medical team. There are some developmental considerations, thinking about, can this occur in kids? Is this just part of the normal maturation process of a kid who's growing older? And the literature really has shown that it's not, that this is above and beyond that. There does have to be some ability to have cognitive maturity and the ability to process emotions. So most of the literature points to sort of the youngest age being about 5, but really around 7, where some of these processes start to occur. So when we're thinking about the current literature just of PTG and children and adolescents in general, it's looked at natural disasters, terrorism, traffic accidents, grief and bereavement, caregivers of kids with chronic medical conditions, or of caregivers of kids who've had other experiences. Much of the medical population research has been in kids with cancer, NICU stays, other kinds of things like that. So when it comes to the transplant literature, there isn't much, and we're going to talk about the 3 specific studies related to pediatrics and PTG and transplant, but within the adult solid organ transplant literature, it's been mostly in lung, kidney, and liver, and they did find medium to high levels of PTG, and qualitative interviews confirmed the presence of PTG, and there was some relationship to medical outcomes. Most importantly, lower rates of graft rejection, lower creatinine levels, and an inverse relationship with adherence. So higher rates of PTG leading to better adherence. So one study was the qualitative study of mothers' experiences of children who underwent renal transplant. And within this article, they found the mothers endorsed a stronger sense of self, new possibilities, enhanced relationships, appreciation of life, and spiritual change. There were really great quotes in this article, but the one that stuck out to me the most was under the spiritual change domain, which was, we're not going to say it's suffering, we're going to say it's an experience. In more recent literature, I was part of a quantitative study looking at youth and young adults and caregivers post-heart, kidney, or liver transplant. Within the youth, we found that the majority had medium to high levels of post-traumatic growth. The appreciation of life subscale was the highest score, and there were no other correlations with demographic or medical variables. Within young adults, so this was 18 to about 25, over 3/4 had medium to high levels of PTG. Again, appreciation of life was the highest subscale, and white young adults as compared to Hispanic or other ethnicities and racial identities had lower levels of PTG. And then within the caregivers, 89% had medium to high rates of PTG. Appreciation of life was that highest subscale. And there was a positive correlation between a youth's PTG score and the caregivers. Hispanic, female, and religious caregivers had higher rates of PTG. Those caregivers of individuals who'd had a kidney transplant had lower PTG. And we thought this was because many of our caregivers of kidney transplant patients had been dealing with dialysis for a long time. And so that sort of ties in with this next point of acute illness preceding transplant had greater levels of PTG. And then just recently published was this qualitative study of adolescent recipients post-thoracic transplant. And they found these 4 areas: personal growth, which was recognition of strengths, scars, apologies for that typo, as a symbol of growth and strength, courage and confidence to explore new opportunities, relationship growth, both with family members and friends, some introspective growth, with gratitude for life, that responsibility to care for the organ, and the transformative experience. And there were some great quotes in that article as well. I do just want to acknowledge, that there are challenges that face children and adolescents and their families who go through transplant. And so there are many psychosocial concerns that come up. And I don't have time to touch base on all of these, but I did just want to acknowledge that it's important to recognize depressive symptoms. These are some of the things a caregiver or medical professional might see in their child or patient respectively, as well as with anxiety. And to just be aware, and one of the points, we're going to talk a little bit about is about asking for help and knowing when to seek support. And so thought it was important to just touch base on these. As well, families, tend to have some challenges, as well as siblings. And so just important to be on the lookout for these. So when I am thinking about interventions and support, I think about this Bronfenbrenner's ecological systems model. And it really provides insight into working with kids and families who are dealing with chronic medical illness. There are lots of areas where we can get support, and every patient and family looks different. So is this support that's coming in our immediate microsystem within our home and peers and the school? Are we getting support from our healthcare system? Is there a psychologist or social worker or child life specialist on the team? Social and cultural supports. So all of these factors play into what's going on. So I do just want to say, when we're talking about post-traumatic growth and trying to foster it, it really isn't a technique. It's a dynamic process that plays out over time. And this is a very busy slide, so I apologize for this, but through here. So this model really from Kilmer highlights areas that we can target when we're thinking about post-traumatic growth. So all of the areas are in blue are often things that I'm identifying during a pre-transplant or post-transplant psychological evaluation. The orange areas may be ones that are areas for intervention. Gray is not something we can change, and then green is our end goal. So oftentimes thinking about where within these areas can the medical team, can families give support. So if we know that there's distress going on before transplant, targeting that as an area of intervention, looking at family therapy, looking at therapy resources for caregivers. So these two questions are often ones that I use when I'm talking with patients to try to assess for growth. So you may have heard some people say they found some benefit in their struggle with difficult situations or with transplant. Given what's happened to you, do you think that's possible? Tell me a little bit more about that. You've noticed that since that you and your family have grown closer after transplant or after you lost your kidney and went back on dialysis. Tell me a little bit more about that closeness. So when we're thinking about points for intervention, it's what Tedeschi and Calhoun describe as expert companionship, which I think most caregivers are, and using that reflective listening. It's having discussion about normalizing the trauma response and emotions. It's encouraging that reflection and using a strengths-based approach to, tell me what things are going well since transplant, right? And making that shift. How well are you feeling versus how much pain are you in, or how difficult has it been? So there's lots of areas in interventions for patients. I would be remiss to not talk about camp and group interventions and peer support. And we are seeing a lot of growth facilitate out of these areas, because that's where that deliberate cognitive rumination is happening. Teens talking about, or even school age kids talking about their experiences with each other. So two just things that I have permission from these patients to share these that are interventions that I have done and just are really interesting is having kids trace their hands and write or draw a message to other kids or to themselves that reflect back on their growth. So this was an adolescent female who received a heart transplant, and I know it's a little bit hard to read, but there are definitely several themes of PTG in there, of new possibilities, talking about how taking medication every day can be annoying, but it helped her to be more organized. And this was at the end of our therapy time together. We'd had many sessions and she'd been in the hospital for a long time. And so just seeing that growth reflected in that. This one also similar as I grow. So they get a blank tree trunk with roots and the beginnings of tree branches. And in the roots, they talk about people or things that have grounded and kept them safe. They then in the trunk talk about these experiences that have shaped them along with trauma and loss. And then in the branches, what they hope to do with their lives. What they want to do. So this was a young woman who had a kidney transplant and had some rejection due to non-adherence, ended up back on dialysis, and ultimately was able to get back on the kidney transplant list. When we're thinking about interventions for family in terms of fostering growth, family partners and mentors, the wonderful support groups through transplant families, sibling supports, having sibling camps, and connecting with other families. So what are some things that parents and caregivers can do? Listen, reflect, validate. Validation and normalization goes a long way. And it's important to be able to just acknowledge that things are hard and that we're not always going to change every feeling, and feelings are okay. Problem solving, when that has to happen, modeling optimism and instead of but is one of my favorite phrases of this is really hard and I'm here to help you with that. Because when we say but, we invalidate everything else we feel before. So a lot of times I'll hear kids and families say, you know, it's really frustrating to have all these challenges post-transplant, but we should just be grateful that we got our organ, right? You can be grateful and still and grow and be resilient and still feel frustrated. Reinforce coping behavior. When you see, you know, kids trying to do their deep breathing or taking a break or using that and instead of but, you know, call it out, give it praise, and then seeking help as it's needed. So I'm happy to answer any questions, any comments, and please feel free to reach out.
I'll give people a few minutes to put some questions in if they have, but I have a few myself. I was curious, with the pandemic, has there been any feedback yet on how families and patients have done?
Just in general, in terms of their coping and
right.
Yeah, you know, we are in the midst of, you know, one of the biggest teen mental health crises we've seen, and that is regardless of transplant or not. And so I do think we are seeing a little bit higher rates of anxiety and depression. I think in some ways, the pandemic, and depending on the area in which somebody lives, kids seeing other kids wearing masks at school was helpful. I think if you lived in an area where there was a lot of pushback about wearing masks, that was almost not helpful, right? It's really geographic dependent. And then just, I think for caregivers, that push-pull of my kid wants to go to school, they, you know, we can't do any more virtual learning. And I need to, you know, they're 8 weeks post-transplant. What do I do? So I do think it leads to some more conversations with medical teams. But so it's a little bit of both. It's the gray of psychology.
Right. I was curious too, if the age at which they had their transplant, if that made a difference for their PTG. It
did not in our study. We really thought it would. I do think so. They were semi-structured interviews that we used the PTG questionnaire, and having done a lot of those interviews myself, I can tell you it was a little harder for them in the qualitative section to sort of outline those benefits if they were transplanted as an infant and now they were, you know, 13 or 14, but we didn't see that in the quantitative scores.
I have another question. Do many transplant patients experience sadness and depression in their post-transplant years?
I think many is a interesting question, or an interesting term, right? It's, you know, we're starting to study more and more what the rates of depression and post-traumatic stress are in our post-transplant patients, and many centers are moving towards a post-transplant psychological evaluation similar to that pre-transplant psychological evaluation to help with identifying that. So I do think as there are different time points just in life and that normal maturation plus having a transplant, I do think there can be episodes. I don't know that it always reaches a clinical threshold, right? Sadness is normal. It's when it's starting to impair your functioning that's when we might need a little bit of extra help. I really tell my patients and families, you know, therapy is like work on a car. You have episodes of care, right? You come in, maybe you just need a tune-up because it's the PSATs and all of a sudden, you know, that's really stressful. Or, you know, you have a mild rejection episode and that's really stressful. So just having sort of that support network built in helps with those time periods.
Right. I think real quick, I think we have time for maybe one more that are kind of related and kind of build on that last question is, do you think transplant patients should see a psychologist post-transplant? And if they don't want to talk about their transplant, is that normal or should a parent be concerned?
Yeah. I'm a little bit biased in this, so I say yes. I think it's knowing, so I think it's knowing that the psychologist is there or the social worker or whoever is part of that team. And that's why meeting families from the pre-transplant standpoint all the way through post-transplant is important. However, I do feel strongly that if someone doesn't want to talk about their transplant or whatever's going on, there's a fine line between forcing and needing support. You know, if we're talking about someone who is making statements of harming themselves or engaging in any self-injurious behavior, yeah, we're going to push a little bit harder. But I have had several patients anecdotally who I've introduced myself. We've had a couple of sessions. We've said, I'm fine. I say, okay, I'm here when you need me. I can think of one young man in particular who recently sent me a message through our medical record and said, you know, thanks for not pushing me. I'm having some anxiety now. I'm ready to talk about it. And so you can do more harm than good if you push too hard.
Well, thank you so much for answering all those questions and giving that great presentation. And I just want to encourage our attendees to come to our next webinar, which is on shared decision-making in pediatric transplant. And thank you again, Dr. Mayersohn, for joining us today.
Thanks for having me.
Bye.